Good evening. I'm Nate Galbreath. I am a clinical psychologist. I work for the Department of Defense. I'm the Deputy Director of the Sexual Assault Prevention Response Office. I'm really happy to be here with you tonight because I don't have to talk about sexual assault for once. I get to talk about healing. And as a clinical psychologist, there's nothing that makes you happier than getting to do that. I started out my career as a special agent for the Air Force Office of Special Investigations. It's kind of like the FBI for the Air Force. It was quite a change coming from being a criminal investigator to being a psychologist. Matter of fact, I remember one day when I was first in the clinic, and the secretary came in and she said, Dr. Galbreath, there's somebody out here that really is having a problem. They really want to talk to you. They think they're invisible. And I said, well, I'm really busy. I can't see him now. Thank you. I'll be here all night. Please tip your wait staff. All right. So we've been talking about trauma, and some of you may have been traumatized by that, and I apologize. But that being said, one of the things that I learned about trauma was that it was so much more common, but it sounds so weird, right? When you talk about when someone says they're suffering from post-traumatic stress disorder, you're thinking, oh my gosh, it's a Rambo movie, or there's something weird that's going to happen, that they're going to go bonkers and shoot up a town and things like that. And that is just really not the case. And having worked with active duty military members and veterans now for the past 16 years, yikes, so a long time, I can tell you that these are ordinary, everyday people that experience things that are just out of the ordinary. And that's really what it is. As Tracy was talking to you and showed you about the fight or flight system response that we have, and there's a freeze part of that too where you're not sure whether you should run or fight, all of that is a natural response. And it's something that makes trauma so ironic, because we think that we have to plan for every eventuality, but you can't plan for trauma. You can't plan to be traumatized in what you're going to do. But yet at the same time, your body is magnificently prepared for trauma. And like Tracy said, it comes from the oldest, most primitive part of our brain, the part, that bunny rabbit brain that makes sure that you're scanning the environment to make sure that you're okay and that you're safe. And that any time that there's just a continuum of different things that can happen, whether that's a stressful bad day at work, or you're in a car accident, or you see an IED blow up in front of you, your response many times is very much the same, because it's that stress response that your body goes through. What I can tell you is that a lot of what we do in the military is to try and prepare people when they are in those circumstances, though, to counter those survival instincts, which is, to run away and stay alive, and to stay and fight. And, one of the things that chemical process that your body goes through when it responds to stress, one of those things that it does is it does give you the energy and the strength to stand up, to be there, to do the things, to be uncommonly brave sometimes. And we're really, really grateful for everyone that makes those sacrifices for our country, that goes out and stands up for that. But we also have to realize that does come at a cost. And that cost is sometimes the symptoms that hang around, that don't go away after a while. And you should all know that it's normal to have those kinds of symptoms. Whether you're in a car accident or whether you've seen a roadside bomb go off, either one of those things, they produce similar kinds of results. That arousal that helps you save your life, that gives you the fight, flight, or freeze response in your body wants to go back to normal after that. But for some of us, it doesn't necessarily get there. And what post-traumatic stress is just your body staying in a heightened state of arousal for a long period of time. Now, everybody would probably experience that those symptoms for a couple of weeks. After 2 weeks or so, the vast majority of us go back to our normal state of being. But those symptoms can stay. And what are those symptoms? I think if you've ever been in a situation where you've been in a car accident or you've seen something where someone could have been hurt or you thought you could have been hurt or seriously injured or died, that you begin to have these memories that pop into your thoughts. And that's called re-experiencing. So it's almost kind of like what some people might call flashback. It's just those intrusive thoughts that come back and you think about it and it takes your attention away. Well, those aren't necessarily pleasant thoughts, and so sometimes another cluster of symptoms that we see are when people start to try to avoid those cues that remind them of those circumstances. And so all of a sudden, if that avoidance takes over, then all of a sudden people's world starts to be very, very small, and oftentimes they don't want to leave the house because they're safest at home. And the more often that they're out, the more risk that they have. And then in addition to that, because of that stress response in the body and the adrenaline that you experience and the cortisol that gives you the energy to be able to fight or flight or, well, what happens is that actually, if those symptoms stay, it changes the arousal level in your body. And so it interrupts your sleep. It makes you feel like you're on edge and that sometimes the worst things could happen. But the good news is that not only are we prepared to face stressful circumstances, we're actually all very prepared to put ourselves back to normal. But how many of you had a class in school that taught you how to deal with stressful situations? Probably none, right? And so if we all, though, did get that class, what we'd find is that healthy behavior really promotes healing. And that's what I want to talk to you about tonight, is that health, what are those healthy behaviors? And I picked out 3 tonight. But before I go there, I got to tell you a story about my first clinical experiences up in Minot, North Dakota. So how many are you from North Dakota then? Yeah? No one? All right. So in case you don't know what the mission of Minot Air Force Base is, it's to launch nuclear missiles and to drop nuclear bombs from B-52s, and then also to guard them from surly Canadians. Because right up there on the border, in the Great White North. So a lot of times, I'd talk to my 18 to 24-year-olds that would come in, and gosh darn, it's their first base. It's their first time being away from home, and they don't know what to do. And they come in the door and they say, "I hate this place. It's a tiny place out in the middle of nowhere, and I got no friends, and I hate my job, and I hate my life." And I'm sitting there crying too because I'm going, "Yeah, I know it's a real small place. I know." And what's amazing though is to watch how the 18 to 24-year-old chooses to cope. In case you didn't know, or if you don't have a teenager or you haven't owned one yet, they always make the right choices, right? They make the best decisions. At least they're entertaining decisions, well, if you can, long enough after they happen. But the reason is that your brain isn't out of adolescence until you're about 25. And so all of your decision-making is rather, what I would say, transactional. In other words, if I do this, I get that. So a lot of times what you find is that transactional stuff is focused on immediate gratification. So what do you do when you cope when you're 18 to 25 years old? Well, the folks that I was talking to, a lot of times when they come in depressed or anxious or just all around angry, they would have, I said, "Well, what you been doing?" "Well, I've been sitting in my room because I don't like it here." "Well, okay, what do you do in your room?" "Well, I play video games, or I'm on the internet and I'm chatting, I'm doing stuff." I said, "Okay, so what are you doing? How are you taking care of yourself?" "Well, I play video games until about 3 o'clock in the morning, and then I sleep for about 3 hours, and then I go to work, and then I come home, and I play more video games until about 3 o'clock in the morning, and then I go get a Big Mac, and then I drink." "Well, that sounds great. How's that working out for you? I hate my life, I hate my job, I hate Minot. All right. So you can kind of see where it's going. And so what the amazing thing is that when you start to give people the skills to take care of themselves, and really this is kind of common sense, but gosh darn, we're not born with that a lot of times. But this common sense stuff, it's going to sound real familiar to you. But these are the things that really, really do make a difference. And I think Tracy and I could do a tag team show together, because a lot of the stuff that she talked about is exactly the stuff. So I'm going to tell you how it works. She told you what it was. I'm going to tell you how it works. So the first thing, what I could tell you is, and as Tracy said, even though we know that healthy behaviors promote healing, a lot of people think that it's got to be medical. It's got to be a medicine show. And there's got to be a pill that I can take for everything. Well, here's the secret. We've got about 25 years worth of data now. And some of the most commonly prescribed medicines that we have out there, so the Prozac, the Paxil, all of the what we would call the SSRIs, or the selective serotonin reuptake inhibitors that we use a lot, those are very commonly prescribed. What we found out is that the effects that they have on the body are really no greater than placebo or sugar pill. Does that surprise anybody? And what's really even more interesting is that the effects from exercise, from psychotherapy, from mindfulness techniques are just as powerful. And they come cheaper, because you can do them without a doc and you can do them by yourself. Now, that doesn't mean that they work instantly. You have to practice them, you have to do it. But they really are just as effective as any antidepressant that might be prescribed. Now, don't get me wrong. There are psychological problems that we must treat with medicine to give people the best chances for success. But I would tell you that mood disorders, anxiety disorders, and traumatic stress, the first-line therapy should be some kind of behavioral modification and not a focus on meds. And why? Because this stuff lasts longer. Because when you learn this stuff, it lasts for a lifetime. So what are they? It's exercise. I know, I grew up, I'm a nerd, I hated exercise. The only reason that I learned how to swim is because we had a pool in the backyard and I fell in one day. So that's how it works. But it's not, you don't have to go out and you don't have to lift weights and you don't have to do anything. Like Tracy was saying, it's just movement. It's just getting out and walking. And why is that? How does exercise work? Well, when you're under stress, your brain and your pituitary glands and your adrenal glands and a bunch of other stuff, they're producing a lot of chemicals that are in a stress response. And so you need to chew that stuff up. You need to metabolize the adrenaline and the cortisol that your body's putting out. Because over time, when that builds up, it causes a lot of problems, as Tracy was saying. It causes intestinal disorders and it interrupts your sleep and all kinds of stuff. So what do? You exercise and you burn that stuff up. And what we find is when you do that exercise, in addition to that, it moderates your mood. Because what we find is that people that exercise, the neurotransmitters in your brain that impact your mood, they tend to balance very, very well. It's one of those side effects that's there. And in addition to that, what we find is that people that do exercise as a part of their psychotherapy, as part of their treatment, or not, just people that normally exercise, they have fewer mood relapse episodes. As a matter of fact, they sustain their gains, their treatment gains, or their good mood a lot longer than folks that don't have exercise as part of their treatment, as part of what they're doing to take care of themselves. So there's one. So there's exercise. The second one that I want to talk to you about is sleep. What's amazing is all of the kids that I was talking to up at Minot and how sleep deprived everybody was. And I don't know about you, but every time I would go home at night, I'd get a little sleep deprived thinking about all the sleep deprived kids carrying M16s around nuclear missiles. Yeah, doesn't let you rest well. But that being said, Sleep is one of those things that is immediately impacted by that stress release of chemicals in your body. That oftentimes it's disrupted. And so you have to practice. Sleep is a habit, just like anything else that we do. So it's really easy to practice good sleep habits and get the results you want. But if you practice bad sleep habits, you're not going to get the result that you want. And you're going to find that you're going to break the association of sleep and your bed. So when I talk to people and they come in and they say they haven't slept for a long time and they're having a hard time sleeping, the first thing I do is, let's talk about sleep hygiene. People go, what, clean sleep? What's that? I said, yeah, you got to do the things that actually bring on sleep. Now, aside from listening to speakers like me, probably putting you to sleep, there's other things that you can do. And what are those things that you can do? Sleep is basically you make your bed a place where there are only two things that happen: sleep and sex. And of course, if you're male, you know the number one thing that makes you go to sleep is sex. So it all works together in the end. So, but that's one thing that you can do. All right, so your bed is one place where that's the only thing that you do. So you're not reading, you're not doing your bills, you're not watching TV, you only keep in your bed just for sleep. In addition to that, if you can't fall asleep in 15 minutes, you get up and you go do something really boring. What's that? Well, you don't read a really good book and you don't watch TV. And matter of fact, you don't do screen time. Because what we find is that screen time actually activates your brain. And of course, if you are watching the news cycle, as Tracy mentioned, or if you are just getting on to Facebook and you're looking at what everybody's talking about, that's probably going to keep you awake and get you real riled up in some cases. So you do something really boring. You read a boring book. You read a boring magazine. And that really often helps. You keep your same bedtime as well. If you ever sleep in on Sunday morning, you might get what we call Sunday night insomnia, where you just can't fall asleep because you got up at about noon. And so if that's not your normal time to get up, then you got to keep your normal time. In addition to that, I could tell you that even though we all like the occasional drink now and then, alcohol is really bad for folks that are having trouble sleeping. The reason is that while alcohol does put you to sleep a little bit quicker and it does make your first sleep cycle a little deeper, it really doesn't help for the rest of the night, because what happens is that it interferes with the rest of your sleep cycles. You go through a number of cycles of deep sleep and lighter stages of sleep about 4 or 5 times throughout the night. And that first cycle might be very deep, but I'll tell you, right after that, you're probably in what we call rebound land, and that you are awake and you're super awake, and it's very hard for you for that delicate balance of, as you're going through sleep stages, to go on throughout the night. So that alcohol really does mess with the second half of your sleep. So the first half of the night might be a little bit there, and then of course, as you become more and more tolerant to alcohol, it causes more and more problems as you become dependent upon it. And so that's, of course, we want people to eliminate alcohol as they're doing that. That's the kind of conversation that I have with folks when I talk to them a lot about sleep hygiene. The third thing is something that I know you might have heard tonight, and it's kind of this catchphrase that a lot of folks talk about. It's this mindfulness. And mindfulness is something that's kind of new in the psychological world. Matter of fact, when I was going through school, we talked a lot about it because it was so new, and we weren't really sure whether or not it was beneficial. But it is, because it takes you out of the stressful world and puts you into a world that you can control with enough practice. And what is this? The things that, if you're constantly scanning the environment for risk and for things that might threaten you, you'll never relax. And so bringing people into the now and experiencing the now and being able to appreciate the moments right in front of them, and to control their body and give them the ability to be quiet and just sense what's going on. Here's a quick mindfulness exercise. We're going to do it right now, all right? So all you have to do, close your eyes for a second, take a deep breath in through your nose, blow it out through your mouth, and instantly you can begin to notice that your body changes a little bit. And enough of that What you find is that you begin to notice things about your body as it relaxes. And if I had you for another half hour here, I'd walk you through the full exercise, but we do a couple of deep breaths. And then we begin to notice in our body the sensations. We might listen to what's going around. You might hear the rush of the air handler. You might hear voices off in the back. But what you're doing is you're focusing on what's going on now, and you begin to feel the sensations in your body. And you notice those feelings, and you don't judge them. You just feel them. And one of my professors talked about how when you're being mindful, you can sometimes imagine that you're sitting by the side of a stream, and you're listening to the water bubble and burst over the rocks. And sometimes every once in a while you might see a leaf, and it might just come floating down that river. And you might just think about seeing what that leaf might be like as it goes on down the river, and you just let it go. And then another leaf comes down, and maybe that leaf, you put the anger from today. And you just let that anger sit on that leaf, and you just let it go by, and you feel it leave your body. And then another leaf comes by, and you think about, maybe that one would be the sadness that I had today. And I'm going to put my sadness on that leaf and let it go by. And I know it sounds like a little bit of hocus pocus and a little bit of voodoo magic stuff, but what I can tell you is that brings balance back to someone who has been hyper-aroused by a traumatic incident. And learning how to do that and practicing that over and over again. What are the benefits of that? Number one is stress reduction. And we find that folks that practice that have much lower levels of stress over time, and they're able to sustain that. In addition to that, it brings about cognitive flexibility. And what is that? Cognitive flexibility gives you the ability to choose how to respond to things. That you have now mastered some of your emotion through the practice of mindfulness and meditation techniques. So you don't have to become upset. And that's the third piece. It's the ability for you to select the emotion, to not become riled up by situations as they present to you. And all of that works together over time to be able to bring balance back. And those are just three of the things. And Tracy talked a lot about a bunch more that we do. But the reason why we do these things is not hocus pocus. It's not magic. It's to bring people back to the balance that they so deserve. The folks that are out there, the vets, the folks that are on active duty, all of them have sacrificed in some way, whether being apart from a family, being apart from their loved ones, being in harm's way. All of them deserve the chance to resume a life and to be productive. And that's a lot of what we do. And as a psychologist who's been lucky enough to work in both a veterans hospital as well as in an active duty clinic, I can tell you that there's no greater joy than being able to return someone to duty or return them to the life that they want to lead. And so that's just a short little list of some of the things that we can do for folks. And thank you so much for your time tonight. Thank you for coming and listening to hearing how we help our vets and our active duty folks that are out there making those sacrifices to the country. And we hope to see you throughout the rest of the week. Thank you so much.